And currently there is a Zoom link for providers. So if anyone else can pop on, they can. So yes, thank you guys so much for sharing the live, sharing the love. So a little intro. My name is Dr. Mo. I am here in the background with Courtney and Neil, who are my lead nurse practitioners at Active Medical Solutions. That's what AMS is. When I say watch AMS, it is not watch green eggs and ham. It is Active Medical Solutions, which is our medical practice. We are a lifestyle medicine practice that deals a lot with GLP1s, but we don't just give you a prescription. We give you lots of advice, probably more than you ever want. So here we are live for an hour to hang out. So if you want to see us, and this is recorded and replayed on Watch Hams. No, it's Watch AMS. I could put like AMS channel. I could do that. I could do AMS channel. Would that be better? We'll change. No, Watch Hams. Oh my goodness. What do I say to women who want to lose 20 pounds but aren't overweight? It's a fantastic question. Thanks for asking. And I did not prompt her to do this. My question is why? So, because you know what the media would say? Oh, you just want to look better. Well, no. What if you feel like a busted can of biscuits and your life is run by food noise? That is a huge hindrance to your life. And I don't care if you're 1 pound overweight or 100 pounds overweight. It is oh, nice background, Courtney. Sorry.
Figure it out.
You just had a really cool background. So my question is, when they pop in, it would be why? Yeah, I want to lose weight. Great. Why? If you're within the healthy range. So, because, that healthy range, like for me, I was talking about this the other day, that healthy range for me is a 111 to 146 for my height. And it is probably depending on the muscle mass. I am not big boned. There's nothing big boned about this, but like I'm 5'4", and that's a pretty wide range. So, if I'm 115 versus 135, I am still well within that range, but 135, I usually get there because of my pathologic food behaviors, aka binging or disordered eating. It's not really binging anymore. It's just eating willy-nilly sort of thing. What's available, what's quick and easy, what gives me the hit, what makes my brain happy. So the question is why? So that's what I would say is why. If you say, well, I have a family reunion coming up and I want to make my cousin jealous, that's not necessarily invalid either. No, I'm just kidding. Now, that isn't invalid, but we really know that that's not the reason that 99.9% of us are doing it, right? We're not doing it for a movie role. We're doing it because we want to live a life in our own skin. We want to wake up and say, holy crap, this is amazing. That's why.
But also with 20 pounds, like, does she just want to get to a healthy BMI? Is that what that 20 pounds is?
Well, she said she's not overweight. So.
Yeah, depends. I mean, yes, her BMI is still, I guess, under 25, but even then, like, that's okay.
Yeah. I mean, my BMI can go all the way up to a weight that I am very uncomfortable, do not look or feel healthy at all, can't do the activities that I would like to do comfortably. So losing 20 pounds for me, I guess it depends what you consider overweight. Is it the appearance of overweight, or is it the actual BMI number overweight? Overweight means a lot of different things to a lot of different people.
Okay, you guys are going to laugh. I'm turning my phone around in the hopes that we can get you guys on here while I go get my coffee. This is like, oh, Lordy B.
Wait, you can kind of see it. Hold on.
Wait, there we go. I got this. That way you can see Neil and Courtney and hear them as I go get here. I can't. It won't go short enough. Hold on. We got this. I have no space on my desk. That is the issue.
We're kind of at an angle, but we got it.
Hold on. I can see you. They can see you. But it's gonna fall over.
They can hear me.
They can hear us. We're good.
Oh, forget it. Okay, you're gonna see my butt as I walk out the door, because I'm going to get coffee. But listen, so now here's the question. Okay, hold on, Neil. Grab Anastasia Marie's question.
Yeah.
You're both on there, so yeah. Grab Anastasia Marie's question first, and I got to get coffee. We got priority.
We got it. Anastasia, my doc won't prescribe because I am not type 2. Any way to get around that? Depends on what we're looking for. It is possible that we can put you on a weight loss medication. So Monjuro is for diabetes and Zepbound is for weight loss. So that is one possibility. Same with the Ozempic versus Wegovy. The other option is to not even worry about insurance and jump straight to compounded. Then you don't have to worry about any diagnosis really, except the ones that would rule you out, like medullary thyroid cancer. That's pretty much it. Otherwise, yeah, we're happy to prescribe for that.
Yeah, I'm curious what your doc says, because there are two brand name medications that are FDA approved for type 2 diabetes, but those same medications are FDA approved for weight loss. So I don't know if they just won't prescribe it due to insurance reasons, or if they just flat are against weight loss medications, because the two
Or they
most
don't know any
common
better.
medications are FDA approved for weight loss. Now, if it's that your insurance won't approve because you don't have type 2 diabetes, that's a whole different issue there.
All right. Any suggestions for hair loss? Yeah. First thing first is make sure you're getting enough protein in. That's number one. We also like to recommend biotin to help with hair regrowth. With any type of weight loss, whether you're on these medications, whether you're not on these medications, whether it's bariatric surgery, you're going to have some hair loss just because of the decreased nutrients. But it does grow back. But it's not uncommon to lose that hair.
And the compounding pharmacies that we work with also have a pill that I started looking into with minoxidil and biotin in it. I don't know the amount of biotin in it, if it's worth it, or if it's worth just getting minoxidil covered under your insurance for hair loss. And then
I believe it's another one you have to split pretty good, the pill up, because it only comes in a certain tablets.
Like the male pattern baldness size.
Yeah.
Sorry, Neil.
It works well though. I have a guy on it. He's growing his hair back. It's better than when he was in high school. So
really? Okay. I'll take it.
Yeah.
I'll take it. Yeah. I mean, I lost about half my hair. And now even a year into maintenance, I hate that word, much like I hate a lot of words now with weight loss, but I have more Muppet hairs all the time. And if you look up close, like it's still thin, relatively speaking. But it's still growing back. Like it is still, we still got production, and it'd be better if I had more protein, but I had my 42. I see your 42, Courtney. I see it.
Got it going. Had my collagen this morning, so I'm up to over 60. We're good.
Nice.
All right. Cheryl's been on 10 for about 6 months, and it doesn't seem to be working anymore as far as appetite and weight loss. It sounds like it's time to go up.
Yep.
If it's been that long, I would still look at other things that you're doing, making sure you're staying hydrated, getting enough sleep, making sure you're getting enough protein, and start there, and you're moving. If that doesn't take care of it, you need more appetite control, which means you need a higher dose.
And Angela Renee.
Go ahead. No, you're good.
She was in the same boat, 5'7", 160, and feels better at 145. I agree. I'm pretty close to you. I'm 5'6", and 160 does not feel good. I don't feel like I look good in my clothes, and I can't run comfortably for long.
I'm learning to pause. I'm working on it. I'm working on it. Thank you so much for sharing and liking the video, by the way. Oh yeah, like and subscribe on YouTube if you happen to go to watch AMS. I never tell people to do that, and I don't know why. Like I put it over, they're like, hey, go watch us. And I'm like, yeah, like and subscribe. That'd be awesome too.
You got 560 subscriber. That's not too bad.
Nice. No, it's not too bad at all, considering I've never even asked people to.
Yeah.
What can I take for sleep? So, okay, a couple things. Did your sleep start with the dietary changes and all the shifts? Did the sleep start because I took away your blankie and you can't eat yourself to sleep anymore? That'd be me. So that was really difficult because my brain races at night. And those of you, the people on this screen that know when my brain races at night, because you start getting weird ass texts about these, hey, check out this article. And you're like, go to bed. So I can't do that very well. Anyway, so it's again, there's of course sleep hygiene, right? Going to bed at the same time every day, doing the things. That's one thing. What I personally take for sleep is a sleep regimen. I do 2 capsules of New Mood by Onnit with 3 milligrams of rapid release melatonin, not 3 milligram tablets. It doesn't work as well. It is the 3 1 milligram tablets. Occasionally meclizine because lately my vertigo is acting up, which makes me sleepy. But normally it's just those 2 things. Now, if I can't take the supplements because I have a procedure or something, Neil helped me out with the doxylamine succinate Unisum. So, but I cannot take a 25 milligram. I'm hungover for a really long time. So I can take like literally a quarter. It's like homeopathic dose, I swear. A quarter to a third of a tablet of doxylamine. Now, but it's more sleep training, right? I don't take these when I need them. The doxylamine I do because I can't take it all the time. But the New Mood and the melatonin I have taken every day since 2016 that I didn't have surgery or something. So it is a sleep regimen for me. These are the supplements that I take to get good sleep. This is a sleep hygiene. This is when I go to bed. Melatonin gives me depression. Really? Yes. New Mood by Anna. And maybe it's the dose too, because a lot of people dose way too high with melatonin. It gives them funky dreams. It messes like it. That's why I do 3 milligrams. That's the highest I've actually ever been. And I could probably go back down to 1 now that I actually sleep at home. I mean, not that I wasn't sleeping somewhere else, but I was sleeping during the day. Never mind. I sleep at night. Well, and I was sleeping upstairs with the whole water damage downstairs. Bullshit. Might as well start swearing early. So it could be the dose. Like my grandmother used to take like 15 milligrams of melatonin. I'm like, what the hell are you doing? It's not a sleeping pill. It's a sleep trainer. It primes your brain for sleep. This is not what it does. Again, like this is stuff your doctor doesn't tell you. They just say, oh, take 5 milligrams of melatonin. 5 for me is way too freaking high. I get real squirrely in my brain. You know?
Yeah. So start low and start finding your dose. Like work your way up and find it. That's with both things. Even the doxylamine, like you can start with half a tablet and see if it does it for you. And if it doesn't, take the rest of it. No one wants to be hungover and just be sleepy for the next 24 hours.
No, it makes me way hungover. Any of those traditional, unless I can sleep like 10 or 12 hours. And when does that happen?
Like it happens in Dallas when I get a boob job. We slept for 12 hours straight because Courtney took me up there. We had nothing to do the next day, and we literally shut those curtains after the guy knocked on the door at 2 a.m. because it was the guy from the wrong floor in the hotel pounding on the door when ready to come in, drunk as a skunk. And I'm like, dude, wrong room.
Yeah, wrong floor.
Like we left our kids at home. Can you please? We need to go to bed. So, oh yeah, okay. So the 5-HTP, if you take Cymbalta, okay, good. Thanks for looking it up. You have to look at the New Mood because it does have valerian root in it and it does have 5-HTP, so you can't have an SSRI with it. So yes, good call. Even though this is not medical advice. Did we do the disclaimer? Did I do the disclaimer? I don't think I did. This is not medical advice. Yeah, I am a doctor. I'm not your doctor. Even if I'm your doctor, I'm not your doctor here. Like Neil's my provider, but not here. Speaking of which, I need more melatonin, or not melatonin, metformin. I started it this morning. So, what not medical advice, not legal advice, not financial advice, and sure as shit, not relationship advice. Don't come to me for that. Sorry, I got kicked out. I asked what I can do to lose 10 to 15 if I can't get on injectables. So I'm active. I get it. We get it. We were talking about that a little bit earlier. Couple of things. If you can't lose 10 to 15 with diet and exercise, let's see my face here. Question is why? If you don't have food noise or if you don't have something else going on, you can, right? If I didn't have a life run by food, I could easily lose 10 pounds, right? I mean, like you just change your eating habits, right? We all know broccoli is healthier than brownies. So question is why? We want a way that is going to help do metabolic repair. These guys know where I'm going with this, I'm sure. And the question is, why can you not get on injectables? Unless you have a history of medullary thyroid carcinoma or multiple endocrine neoplasia, or you're a heavy drinker, there's really no reason you shouldn't be able to get on injectables. helps some metabolic repair, get yourself, maybe you only need to be on it for 6 months until your body gets back into like, can do shit again the way it's supposed to.
Yeah. Sad fact of life, I've tried to outrun my fork for decades, and I could run far. I could be active for 15 and a half hours.
I was going to say, we could go 146 miles. The fork
Yep.
was still right there.
Still not comfortable because I was not at a healthy weight, but I could run. We've got pictures of half marathons and half Ironmans, full Ironmans at an undesirable weight despite the activity.
Yeah. 146 pounds or 146.6 miles with an extra 40 pounds is really not comfortable.
Yeah, it's not comfortable. My problem was I could not get my food habits under control for long enough to sustain a weight that was comfortable for my body. Sad fact of life.
Mm-hmm. I want to grab SM's comment first.
Yeah.
Why not heavy drinker? If you are a heavy, no, that's twofold, because if you're a heavy drinker who's had pancreatitis, you're guaranteed almost to get pancreatitis again on these meds. Now, there's some other pancreatitis things in there that just, it's really the only time we have seen it is with heavy drinkers who've had a history of pancreatitis. If you're a heavy drinker without a history of pancreatitis, I would actually recommend getting on not Ozempic or Wegovy, but Mounjaro or Zepbound or tirzepatide, because it's going to interrupt that reward cycle. It's going to help interrupt. There's no magic pill here. Trust me on that. Those mini eggs still call my name. But it will interrupt the reward cycle, and it may help you stop the heavy drinking, which I think would be amazing. So, I mean, unless you want to continue to drink heavily, and then Tampa General is a very good liver transplant center. Sorry. Not sorry. Actually, the number one cause of liver transplants right now in the US is fatty liver from obesity. So either or.
Yeah.
That was a rough gig. I trained there and it was really hard to see a lot of people.
Oh, yeah.
Plus getting blood thrown up on your shoes all the time sucked.
I'm going to add to that. Plus, if you're trying to lose weight, alcohol is not your friend. It's going to be used first for, like, for energy, and it's going to kind of slow things down. So it's, at the end of the day, it's poison. It really serves no purpose inside the body other than make you feel good, whatever. So I'm not going to be, not going to knock drinking. Go ahead. It's not part of the weight loss program. It's just not.
You're saying this, Neil, and I'm thinking he's talking about sugar.
Not necessarily that, because some people like. I
don't mean sugar like I'm not talking sugar in my ketchup. I'm talking like sugar.
Just one of the bodybuilders I follow, Lily posted this today about alcohol. Like, it's not part of the bodybuilding lifestyle. Like, it serves no purpose. He's like, it's
was
not.
It Alan?
Like, what's that? It wasn't Alan.
Was it Alan?
It wasn't Alan Aragon.
Okay.
But even with people like, oh, I have my wine. My doctor tells me to drink wine for my heart. Well, you could have grape juice. So
your doctor's an asshole. Sorry.
Yeah, it's not the alcohol that's helping you with your heart. It's the grape juice and the antioxidants in it.
It's right. It's the skin of the grape. It's eat grapes. How's that sound?
It's just, it's going to slow your progress down, and at the end of the day, the meds are expensive. They do have side effects, and you might as well get the most bang for your buck.
I have a funny story that I can't say.
Oh,
I can't say. I need to use the name, change the names to protect the innocent. Okay. Or protect the guilty for that matter. A friend of a friend said, was talking to my friend and said, aren't you worried about what you're injecting into your body? As he had his third martini of the evening. That's all I'm going to say.
Yeah.
The guy who's been on HCG diets over the years takes B12 shots. Like, come on, guys, come on. Anyway, so Kristen's question, do we help people get hooked up with injectables or PO meds to lose weight? That is what we do all day, every day. The reason why we're here live is because there's a lot of misinformation out there and it drives us crazy. So we have to get out there and tell people, and not to say we're perfect, right? And there are a ton of other good providers out there that we will help you get to, because we don't do all states. If you go to amstelehealth.com, that is our website. You will see our faces there, /team if you want to see our faces. But amstelehealth.com, click be a patient. Check the states first. If you're not in our states, you can hit up Nikki Baldwin or Maribel Campos. Nikki just doesn't do California by choice because it's too hard to manage their laws and regulations. But Maribel lives in California, so she is my California go-to. And she has also invested in the Freedom to Practice program, by the way. So if you guys see Maribel Campos coming in, she's coming in.
Awesome.
So
good.
Yes.
Good.
Yes. All right. What is Just Be Nice? I love that Just Be Nice. That's amazing. Was on semaglutide for 4 months, lost 10 pounds, but it made me so sick. Yeah, go on Mounjaro.
Yeah.
Sorry.
Well,
Somebody else has a better example than that.
But
why did
tirzepatide
it make you sick?
Yeah, like so there are a lot of providers that will prescribe and then perhaps not follow up. I think one of the unique things about our practice is we keep in very close contact. You have unlimited access to us via text message. And we have a very interactive patient population, lots of tips and tricks. We have articles posted on our private website, how to manage these side effects. For the bulk of people, we can manage these side effects with foods and timing of foods. Now, there are some people who we can't, and it's just difficult to overcome. And at that point, you would want to switch to tirzepatide. But if we manage your food and give you tips and tricks of how to time that food, what foods to eat, increase your dose very slowly, time your dose, we can manage a lot of those side effects and help you be successful at weight loss without suffering.
Yeah, this could be just as simple as like they started you too high, they started to increase you too fast, or it's possible this drug's just not your drug. The tirzepatide would be better.
Or you could have eaten Whole Foods meatloaf.
That's it. Or you're just eating the wrong stuff the whole time.
Yeah.
And stuff that's okay.
Like, things change.
Like it was okay. Like you could just be like, oh, I'm gonna eat a lot of broccoli, and that's just making you sick as heck. You're eating lean beef, making you sick. Like, there's certain foods that just bother people.
Mm-hmm. And it's weird. It's not the same. It's not like, like Neil likes a little bit of like beef jerky or something to like quell like a queasy stomach. And I'm like, that is totally the opposite. That'll sit there for like 10 hours for me. Like it just doesn't, it's just very different. It's just very different. Pamela.
Yeah, you got it.
Yeah. Pamela was on semaglutide Oh, wait, no. Hold on. Pamela's, yes, you can take it a day early. So I can't find the comment. Oh, there it is.
Yeah, she was asking if you could take it a day. It's supposed to do Friday. Yeah, day or before or after is fine. Like if you're traveling, don't want to travel with it, that's absolutely okay.
All right, grab more questions. I'm going to look up Gabby's.
Okay. Semaglutide injecting in the abdomen, sick all the time, now on tirzepatide in the thigh with no sickness. We do have, and it was reported in the study, some people found different effects with changing up their injection site. So that is a suggestion that we offer to change your injection site, see if you get less side effects or increased appetite suppression. It's an individual basis for certain.
Yeah. Kathleen's asking, she gets really tired first days after injection. Any suggestions? Yeah, so first, just make sure you're hydrated with electrolyte drink. We like those at least once or twice a day. If you're not eating, you're not getting those electrolytes in the food. You're not getting the moisture from the food. And it could be just a little bit of dehydration to start there. I'd also try eating like a little bit of carbohydrates, like a couple apple slices to kind of give you a little bit of sugar and see if that's the cause of it. That your sugar is just a little bit lower than it normally used to be. And your body's just going to have to adapt to that.
Yeah. Gabby asked, have you heard of Mounjaro helps with fibromyalgia pain? I'm on 7.5 and still in pain. We figured out last night that in the STEP trials, CRP, which is an inflammatory marker, was reduced by up to 60% in the population in the studies, which was huge for inflammatory processes. But I just did read that I just didn't know that insulin resistance is part of the fibromyalgia picture. Who knew? I have no idea. But so it should help, but 7.5 might just not be your dose yet. Now you could have a dose for weight loss, you could have a dose for appetite suppression, and then you could have a dose for your fibromyalgia pain because you're halfway to the max dose. It's almost like if I take 2 Advil, it might make my joint pain better, but it doesn't hit my fever. There's a fever dose and there's a pain dose. So same with anything else.
Yeah, I think you were talking about the CRP yesterday, and then the higher the dose, the more of the reduction in the inflammation markers. So it just might be a higher dose to need to get her inflammatory markers down, that it would make a difference.
Yep. Agreed. Can you guys on TikTok hear Neil okay and Courtney okay on the speakers? Let me know. Can you take Manjaro if you're taking Emgality or migraine meds? Yep.
Yep. Yep.
Oh, you got yeah, but we got lots of hope. We got lots of hope. And see, with the fibromyalgia, I'd want to dig in because I want to dig in. Because like right now, every freaking joint in my body hurts, and I got 2 words for you. Okay, that's 3 words. Chocolate chip cookies. I'm like, wait, that's 3 words. Because I bought them for my husband's birthday. For my husband's birthday. Let's be honest. But they're there. And I just grabbed one when I rocked right by. Guess what I had for breakfast with my collagen?
But you had your collagen, so that helps.
I did.
Yeah, it'll help the rest of the day.
Yeah.
Huh?
It'll help the rest of the day with cravings.
Yeah.
I actually thought of that. I was in the car and I'm like, you just ate 2 chocolate chip cookies for breakfast. As soon as you walked in the door, I'm like, yes, but I had my collagen and I grabbed my 42-gram shake. So the rest of the day will not be this way. And it doesn't have to be. I don't have to wait till Monday to restart. I don't have to do that.
Yeah. Amanda and I talked about that the other day as well, that like, that's the difference is, that's one of the differences is previously, if you had a, cinnamon roll for breakfast, whole day's gone, forget it. I'm eating burgers. I'm eating lasagna. Just forget it. I'm getting the chocolate cake. Like the whole day's gone. And you know what? Yep. The rest of the week is gone too. That's it. I'll just start again on Monday versus now.
I'll start again in 2025.
Yes. Versus now I have a cinnamon roll and I go, oh, okay, not the best breakfast. So for lunch, I'm going to have a shake and be done.
Yeah. Yeah. And it's a game changer. And I read an article this morning. I posted it in school. If you're our patient, SKOOL is our AMSprivategroup.com is our private patient group. And it's not HIPAA compliant, but it's a nice safe space for us to be ourselves. And anywhere we are as AMS people is pretty much a safe space. But anyway, I posted this article that a patient had sent us that was just amazing on the shame we carry with food and like the mental game and the mental shit that, ate chocolate chip cookie for breakfast. Looks like the rest of the day's shot. Can't eat a vegetable because why would I? Like, I don't even know where that comes from. It's the dumbest logic ever. Like, it makes no sense. But it does make sense to my sick brain because it's an excuse. Well, like I said, on vacation, I didn't take my nighttime supplements or meds because it fills my stomach too much and I couldn't eat the crap I wanted to eat. That's the way my brain works. And it just is. So, Cheryl, hold on. Cheryl's got a great question. Do you see Cheryl Brown not losing anything, been on Manjaro over 6 months and made it all the way up to 12 and a half? If you have made it consistently to 12 and a half and not losing any weight, you're not done. We have patients who had to spend 3, 6, 7 months on 15 before their weight started to budge more than half a pound a week. And that's like a lot of that was older people, not older, but or cortisone or cortisol people, stressed out people.
I ask, is your appetite controlled on that dose? Like, are you hungry like most of the week? Because it's possible it's just not high enough for you at this point.
And we have other things that we look at as well. Like, okay, are you having a protein forward diet? Because that goes a long way to keeping your appetite controlled, keeping you satiated throughout the day. Are you sleeping enough? Because if you're not, and your cortisol levels are high and your stress isn't managed, that's going to inhibit weight loss no matter what we give you. So there's other lifestyle things to help manage to get some better weight loss as well.
Yeah. A comment up above by Marianne. Is there a better time of day or body area to take Zepbound? So body area, you can just kind of try different ones. Some work better for other people's, like Courtney was talking about. The belly works great for some. It's super easy to get to. The back of the arm's a little tougher, or the top of the thigh. Try experiment. Otherwise, time of day doesn't matter. It's really long-acting drug, so you could take it in the morning, the evening. It shouldn't matter. If you're worried about taking it and you have like something planned or work, because if you're afraid of getting nauseated, I would probably take it like on a Friday, and then you have the weekend to kind of recover if you need it.
And don't take it anywhere near like a very large meal.
Yes.
Like if you just went out to eat and
Oh,
today's your dose and you want to get back on track tomorrow, wait several hours before taking that, or wait until the next morning. You'll be up sick all night.
yeah. And they're done that. We have chat comments that I didn't see.
Oh,
Um, can you send a prescription for minoxidil to my pharmacy if I request it? Yep.
As long as there's not any contraindication.
There you go. So, yeah.
caveat.
Yeah. As long as it doesn't interact with your meds or anything, we'll check that out. But absolutely. And then I've had 3 lumbar back surgeries and in worse shape now than before the first surgery. That does happen. Back when I worked in sports med and physical therapy clinic, we saw that all the time. But of course, we only see like now we work in the ER, so we only see the bad things. We don't see the PT clinic things. We see the bad things. And it does happen. It does happen. Well, it's almost like that article that I was saying today that if you're check it out in school, or I can post it somewhere. It was from the Business Insider magazine on shame and stuff. But anyway, he talked about how, a lot of patients who have bariatric surgery, and we know this from our practice, patients with bariatric surgery gain their weight back oftentimes after, right? It's like back surgery. We don't fix what caused the malfunction in the first place, so that period, we're there, it's like when people say, well, when you stop taking the medicine, you're going to gain the weight back, which it may or may not be true. Depends on the person. It depends on the reasons why you're taking it, blah, blah, blah. But yeah, like it's like telling someone with high blood pressure, if you stop taking your medicine, your blood pressure is going to go high again. Yep. That's how it works. Like when you manage a chronic condition, sometimes the factors that brought on the chronic condition cannot be reversed. It's kind of that simple. Lumbar nerve ablation on March 1st. My God, I hope it works.
Yeah.
I hope it works for you. Hold on, I misread that post. It was missing an R anyway, the comment, but I'm like, Dr. Deceased, that's bad. I'm like, no, wrong. Sorry. Oh, it's all good. Also bad. All right, was gonna start tonight. We'll wait till the morning. Yeah, be careful. Yeah, don't give up. So the bloating, okay, so Cheryl said her doctor moved her back down to 7.5 because of bloating. Yeah, you need to work on what you're eating and when. And allowing the drug to work. This is a big thing that we don't talk about as much as we should, especially with the newbies coming in. I know you guys aren't our patients and this isn't medical advice. Okay. But we are also patients who are on or have been on, well-educated patients who have been on either semaglutide or tirzepatide in some form. Right. And the biggest thing in the beginning is you have to be able to allow the drug to work, which, don't overeat it, or don't eat the things that, number one, make you feel like crap, right? We've got a lot of years of diet mentality that say, well, you can only eat lean protein and vegetables. That bloating, that's just bloating. That's all bloating. You need to, decrease your food volume. That's one thing your doctor doesn't have time to tell you this. You're like, well, how do you have time to tell us this? Because that's what we do. That's what we tell our patients. And that's why we do this. We have actually 2 patient meetings a week and then 2 public lives a week, because doctors don't have enough time to tell their patients this. They don't. They're getting paid 45 cents from Medicare and they don't have enough time.
And there's a team of 6 of us with all different tips and tricks. And hey, I found this works and this works. And then we keep a lot of those things pinned and posted in our patient-based website to help along the way. And your doctor does not have time to do that. And most practices don't have a website full of people that are going through the same thing that you're going through and don't have a community support group. If they do, great. They just, quite frankly, don't have the time when they're managing everyone's high blood pressure and diabetes and heart disease and PT referrals and prior authorizations and appointments. And they just don't have the time. It's unfortunate.
Yeah, they don't.
Yeah. What PO meds do you have? I bruise so easily and definitely want to get on something getting married. So there is one oral medication that's like these meds we typically talk about, semaglutide. It's called Rybelsus. It's just a matter if your insurance is going to cover that one or not. We don't have a compounding pharmacy yet that has an oral version of tirzepatide or semaglutide.
I'm
But
looking up
otherwise,
the savings card to see what it has.
yeah. I mean, otherwise there is other options. There's something called Contrave that people use. It's a combination of Wellbutrin and naltrexone. Wellbutrin is used for like people to quit smoking, so it kind of cuts that a little bit. And then naltrexone is used for basically people who are like addicted to like alcohol or drugs. Kind of blocks that reward system to kind of help. So you don't get that hit when you eat that cheeseburger. So some people, I think, Courtney, you have some people that are having some pretty good success on it. But again, it kind of depends on what other medications you're taking, if that's even if it's an option for you.
Yeah.
So the Rebelsis savings card, you save $300 per month if your insurance does not cover.
Okay.
And then it gets it down to a $10 copay. It can get it down to a $10 copay if it covers. So you're still paying $700 a month.
Yeah.
So if you bruise easy, that's what you don't want to do an injectable. Is that what I'm hearing? I think that's what we're hearing, is that we don't want to do an injectable. I would just put it in a spot that nobody sees.
Yeah,
I bruise real easy.
They're
I have
tiny
granular platelet disorder.
Yeah. Yeah, if you don't have some disorder, I mean, it's a tiny, tiny, tiny needle. I bruise relatively easily as well, but I think one time I accidentally hit a wrong spot and developed a bruise.
Yep. The bruising is so random. Like you never know.
It's not.
Yeah. And
It's
sometimes
not
it's
one of
with
those.
a compounded little needle. Sometimes it's with the harpoon. It just depends.
Yeah.
Joyce is taking Ozempic 0.25 with no problems. Can I take Tenuate Dospan also? It looks like it's a stimulant type like phentermine. I mean, at the end of the day, I would say no.
You'll give your opinion. Let her rip.
I don't think you need it. I mean, you're already on the best weight loss medicine there is. Most of those other ones that are stimulant, they stop working after a couple of months. That and they have a bunch of side effects. Usually it's like palpitations, heart racing, dizziness, and people feel like crap. We don't prescribe insomnia. We don't typically prescribe them, or we don't prescribe them because we don't believe in those ones.
Yeah, the risk does not outweigh the benefit.
Yeah, especially when you have access.
And it's not that we don't believe in them. It's that we don't believe in them. No, just kidding. It's that the number one, the risk does not outweigh the benefit in that class of meds. It doesn't produce long-term weight loss. If it did, some states wouldn't limit them to 3 months legally. By law, you have to take a break from them. Yeah, whatever. Anyway, the risk just doesn't outweigh the benefit at all, especially now that we have hold on, sorry. I had a note for a call at 2:00. Now that we have meds that actually work and cause metabolic repair and not just speed. It's not just taking speed. We don't prescribe cocaine either.
Bummer.
But darn, I've been tempted to try that diet.
Tina's postmenopausal 64 with belly fat. She's losing slowly on tirzepatide, but the belly is staying. So that's pretty normal. Like your body will put it on where it wants to in certain orders and take it off. So you might lose everything everywhere else first, and the belly stays. You might lose a little bit of your butt, then your belly goes, and then the rest of your butt goes. Like it's hard to say what's going first. Usually it's genetic. So, but keep at it. It will come off.
It will. All right. I am totally lost on comments. So you guys read.
Pamela asked if we take a lot of electrolytes in our water. So we do recommend at least one electrolyte drink daily. And that's because we get so much of the electrolytes that our body needs in foods that we eat. As we decrease those foods, naturally the electrolytes that we take in decreases. So we definitely recommend staying hydrated because you get a lot of liquids from foods that you eat. So you need to increase your fluids as your food goes down, and at least one electrolyte drink daily. And that can be, the guys up there have Body Armor Light, or coconut water.
He'll add salt to his prime because it doesn't have enough sodium.
Liquid IV, there's tons of things out there, different powders you can add to a bottle of water or a cup of water. But any of them, at least one electrolyte drink daily tends to help.
Wegovy with bad diarrhea and nausea. It could be the food you're eating, but diarrhea is a much more common side effect on semaglutide than tirzepatide.
And usually I
Or
tell
your
people,
or your dose is too high.
could be that. I tell people to start keeping like a food diary to kind of see what foods they're eating and when they get diarrhea and see if that's the cause. A lot of times, like really fatty foods, like if you go get fast food, you're going to get diarrhea.
Yeah.
And a stomach upset, nausea. So sometimes it's timing.
You are going to be the Pepto-Bismol commercial.
D-Dub met their A1C goal at 5.6 at the 7.5 milligram doses. Congrats. Quite a bit of nausea at that dose, so the doctor decreased to the 5. Now there's not the same appetite suppression. Yeah. I mean, depending on how long we're up there and then move back down, it might be time to move back up. Some people like go up too soon for themselves and have to go right back down.
But then after a little bit, it's like, oh no, I need to go back up.
Yeah. Or even take the 7.5 and space it a smidge, so the levels just aren't as high.
Yeah. Somebody had a Zepbound thing. We're probably behind this. 2 months in on Zepbound and haven't noticed a difference. Then you're not at your dose.
Yeah. Give it time.
And make sure you're doing the things. Let's go through our rocks. Ready? Our big rocks. Sleep, stress, sleep 7 hours a night, ideally quality. I have a ring that tells me. Sometimes it overestimates, I think. It tells me my quality is too good. Because I'm like, it slept like crap. And they're like, 87. And I'm like, all right, I guess. Maybe I wasn't moving around a whole lot, but my brain was active as crap. Sleep, stress, protein. Front load your protein. For females, we should really start changing this, I think. For females, you're looking at 100 grams of protein a day. For males, 150, unless you're a teeny tiny male. It's based on body size, but so that's why we do it. It just says general stuff. Remember, this is not medical advice. Feel free to ask us questions. I'm missing one. Sleep, stress. Oh, hydration. Hydration with electrolytes. We just talked about that up the yin yang. And then movement. We added 5 is movement. Resistance training is preferred. Make sure you have, cardiac clearance for that sort of thing. Or for any activity whatsoever. But although we say resistance training is preferred, any movement is good. Any intentional movement. People will say, oh, I run around after my kids all day. That's not intentional movement. It's not. It's not going to combat sitting in a chair all day. The new smoking.
And diet quality. The one we don't like to talk about because we're not always
we're not saying that as a big rock because I can't put them in the big rock category unless I'm doing it. So
I think you start with all those other rocks and hit your protein goal, and then I think you adjust the diet quality later or address it. I mean, I think still at the end of the day, I would not try to get you're not going to be able to get your protein from at 100 grams with poor quality foods. You're just not, because you're going to be sick to your stomach and just not be able to eat.
And then you're going to overeat the drug because you're trying to get protein in with the chocolate chip cookies, and it doesn't work. It doesn't work.
How many chocolate chip cookies do I need to get 150 grams of protein?
All of the cookies.
That's a lot of cookies.
That's a lot of cookies.
At 1 gram a piece, that's a lot of cookies.
Even at the protein cookies, that's a lot of cookies to get the protein goal.
Best to take Zepbound on an empty stomach. It doesn't work like that. If you're doing Rybelsus, which is oral, you have to take it on an empty stomach. But like Courtney said, just don't back it up to a huge meal because it will cause your GI tract to slow down and it will make you feel like poop. Speaking of which, when people say they're super nauseated, I get that. Like if I go up in dose, which I kind of need to, I think, I don't know. I got to figure it out. I get pretty nauseated day 2, like the green face, the green face emoji. But it's not going to kill me. Like, I'm not throwing up. It just makes me feel like crap. Okay. Being fat feels like crap too. Having my joints ache because I'm eating too much sugar makes me feel like crap too. Sleeping like crap because I eat too late at night, which I don't do anymore very much. That makes me feel like crap too. It's not always about the medication. So just, again, that's why we talk about all these lifestyle medicine things, because there's so much to talk about that, it's not all eat less, move more, which we will probably get on a soapbox about as well. Because eat less, move more doesn't fix everything. But now that we've got medication in our back pocket, literally for some of us, that can help, we can make these changes to make our bodies feel better. Like my weight's fine. My elbows hurt today. Like everything hurts today. So I got to change some things, right? So but like Neil said, don't change it all at once. Don't stress out about the changes. Allow the changes to happen. Get your protein in. When you get the protein in, you will start to make better choices. Don't push because then that increases your stress. And then we go back to that stress thing.
Gabby's been on 7.5 for 3 months and has lost 5 pounds. She's type 2 with 5.5 weight loss. Oh, will it be fast? Will weight loss be faster? So everybody's a little bit different. If you're not having your appetite controlled at that 7.5, you probably need a little bit higher dose. But we do have patients that the weight loss is pretty slow, 0.5 pound a week or so. And that's okay. It's still going in the right direction. And, as a type 2, you're still having some repair inside your body. So it's a long-term thing.
Yeah, it's a long process to get there. And, some of the diabetics that we've treated, literally one of the ones that she always sticks in my mind, because, she was 160 pounds, teeny tiny. Relatively speaking, short little lady, and it was 3 or 4 months on 15 before anything went anywhere. And she was so tired. She was like, I want this to be better. And now she's down 40 pounds. And, is she rocking a size 2 swimsuit? No, but she's down 40 pounds and feels amazing. And she's keeping going. So, Honey asked, insurance doesn't pay for me. Do we support compounded tirzepatide, and which is more affordable? We do support compounded medications in this space because we believe the risk benefit ratio is in their favor. We don't use just any compound pharmacy in our practice. We do not condone ordering the meds on your own without a doctor's support. They are prescription medications. I will say that every day and twice on Sunday. The people, because I've got acquaintances who will order from the peptide companies. I'll just do it myself. Brilliant. Don't. These are prescription medications that need to be managed by qualified providers. Ooh, a little bit of soapbox there. Sorry.
How do you know when you're supposed to, when you go up dose?
When you're talking too much about chocolate chip cookies.
Yeah. When you're not losing your appetite, mainly actually when your appetite's not suppressed. So if your appetite's coming back on day 3, day 4, and you're not having side effects, it's probably time to go up in dose. If you're having, good appetite suppression for 5 days and you're happy with that, I would stay at that dose unless you want more appetite suppression.
Jules is asking, any recommendations for that day 2 when you're nauseated and puking?
You should never be puking.
Yeah, vomiting is not a little nausea. Sure. Vomiting is not an acceptable side effect, especially not consistent vomiting
unless you're eating Whole Foods meatloaf the night before.
That's what I was going to say is let's look at what you're eating and the timing of those foods. A lot of us have to be really, really careful on day 2, or if it peaks on day 3 for you. And we know that ahead of time and have to be just really careful with the things that we eat on those days. So that's the first thing that I'd look at. And if you're like, no, I'm eating, relatively clean, nothing too complex, maybe too high of a dose. If you're consistently puking every week on day 2, that we would not recommend staying at that dose. That's not an acceptable side effect.
And you can get to that dose maybe later, but we may need to get you there. We don't do protocolized care. We don't do, start month 1 at 2.5, month 2 at 5. We do not do that because some people can't handle it. Some people don't need it. And it's a waste of money.
If you're on compounded, we've had some pretty good success with people splitting their dose in half, like taking, half of it on Monday and the other half like Thursday. And we can increase the dose, keep their appetite suppressed, and not have side effects. GSD was the one with diarrhea, saying that not eating bad, though. So it is possible that you're one of the ones that just gets diarrhea with the medication. The symptoms usually subside a little bit. It might not be bad food. It just not be food that agrees with you. Some people just can't eat red meat. They get horrible indigestion and their stomach hurts when they eat red meat, even if it's a lean red meat while they're on the medications. So I would just look at what you're eating and see if we can figure out one thing that's actually causing that. Is where I would go.
Alyssa said in California, getting 0 from my doctor. Yeah, we're real familiar with that. We went through it. We all went through it. Well, except for Courtney. Courtney had a good nurse practitioner who helped us all out. But we don't do California, but you need to talk. Well, you don't need to. You can talk to Maribel Campos. She's on Push Health. Can somebody type that in there for me? M Campos, or go to amstelehealth.com and there's a link to her on there. That information's at amstelehealth.com for California. And we don't like work with these people. I mean, they're colleagues, they're friends. We're of the ilk that rising tide lifts all boats. If you want to go with someone who's not like a small private practice person, you can go with Join Mochi or Join Fridays. They also are in all 50 states. There's really no reason. Please read my comment. Hold on.
I don't remember seeing that name pop up.
Hold on, say it again, because sometimes it doesn't pop up. So can you say it again?
Again, yeah.
We had this last time. Oh, hold on, we missed one too. I'm at 1 milligram of Ozempic and stopped losing, but scared to move up because of constipation. I hope to God your doctor's helping you with the constipation, because it's fixable, like super cheap fixable. Little Miralax, little Colate, some fiber gummies, depending on what. We'd have to talk about your diet and stuff, but
Some
in
hydration.
the beginning, hydration, right? In
Movement.
the beginning, I had to go Miralax and movement, because I'm prone to constipation anyway. God, I love the internet. Jesus Christ. Like there's nothing, nothing we're not willing to say out here on the interwebs. But I'm prone to it anyway. So when I first started Mounjaro, it was like, wow, I'm never going to go again. So I had to do Miralax in the beginning, but that subsided over time. And it doesn't in the studies, it does in most people. But I'm trying to look for that comment. I can't find it.
I couldn't find it either. She's on compound, down 67 pounds in 5 months, but I feel weak and wobbly legs.
Oof. That's not good.
I don't know if that's, you need the workup for that. Like you need a workup unrelated to a GLP-1 for that. You need, like, do you have claudication? Do you have, I mean, is there something like, as real doctors, nurse practitioners on this line, we don't automatically attribute everything to the medication. I would worry about everything from brain stuff to circulation stuff in your legs. Like, I don't know. What do you do? Is there a brain tumor up there? I don't freaking know. Yeah. Like, it might not be the drug. It might not be related.
All blood work's normal.
All blood work will be normal if you got a freaking brain tumor.
Yeah.
Like, sorry to be like scary, but this is what I think. No wonder I don't sleep.
That's a lot of weight still. That's like almost 3.5 pounds a week. So it's whenever you lose weight, especially rapidly, you're going to lose some muscle. It could just be some muscle wasting that's the weakness, but it could be something up in the brain
or MS.
Yeah.
Yeah, it
or
could be
peripheral neuropathy, or who knows. So blood work. People say like blood work's normal. Yep. Blood work is going to be totally normal, especially from like primary care blood work. They're going to look for things like leukemia, anemia. What else? Low platelets. That's it.
So
that's kind of it.
I would say maybe like some hypoglycemia, like low blood sugar, maybe causing the weakness. But if the labs are normal, that's going to be normal in the labs when you're already fasting. So that I don't think that's what it would be.
Yeah, you can try if we want to say perhaps it's a side effect of the medication. Let's make sure you're getting in adequate protein, as well as adequate hydration with electrolytes. We do have some people that feel a little weak or a little muscle achy if they don't have adequate hydration and electrolytes. So aim for those two things. If we want to say potentially it's the drug, if those simple fixes don't fix it, a more in-depth workup would be needed.
Yeah, try the hydration. Make sure it's something like coconut water, or Body Armor Light that has a decent amount. Well, how much does Prime have on potassium, Neil?
I
don't have my reading glasses up here, so I'm like
700.
I don't know. 7. Holy
that's good.
700 is a lot.
That's why I usually split them and add some extra sodium.
Okay, because it's too heavy on the potassium.
And I
All
tried.
right.
Okay, so electrolytes helps. So she tries it one day. It could even be because typically they don't check magnesium. It could even be a little bit low magnesium, and then
Yeah.
your normal potassium or like sodium might just not be like others, and you need a little bit higher numbers.
Yeah. Yeah, because the numbers are ranges, of course, almost like the BMI, right? Your numbers are ranges. We know where we feel best. So yeah, if it helps so much, absolutely. Um, and you can do our stream ends in 5 minutes on Watch AMS, and then we'll get off in a couple. We know what we're limiting this. We're limiting this. We are stopping at an hour. I'm promising myself because we'll sit on here forever. Um, Now, okay, if it comes and goes with my leg, if it's one leg, we need to figure out what's going on. See, I'm gonna scare you. I don't mean to scare you,
Yeah.
but don't ignore it. Don't assume it's only the drug, right? Do electrolyte stuff. Maybe you got a bulging disc or something. Like, who knows? We don't know. But don't assume it's just the drug, but don't try to not fix it in the meantime, right? Sorry. No, no, no. It's okay. My brain thinks this way anyway. It's all good. um, this is how I live my life. Imagine living in my house. Um, so whatever, So anyway, no, I believe me. I'll come up with 45 things that can kill you in the next 30 seconds. It's all good. That's why I did emergency medicine, because it totally fit my brain.
But
I
that's
thought maybe
good.
it's dramatic weight loss, and it could be. It very, like Neil said, it could just be muscle. Like, you're much more sensitive to that. Plus, now your center of gravity is all different. You lost 67 friggin' pounds. Like, you're off. Like, you're off. Just kidding. But you know what I mean. What are my thoughts on taking BioBoost Plus while you're doing GLP-1? I don't know what it is. I love that. I'm not gonna lie to anybody. Oh, use Push Health. Push. Shayna, were you saying? Shayna, were you saying you were in? Okay, hold on. In California. No, Alyssa was in California. Okay, sorry, I couldn't remember who was in California. Yeah, if Missouri. Okay, so yeah, if you want to go, if you're in Missouri and you want to go with Nikki, who's a good friend of ours, you can watch our podcast and stuff. We talk a lot about shit. She's going to be on Monday, actually. Nikki's going to come on this on Monday. She might start doing some of our public lives with us. I should get Maribel on, but she doesn't want to. She doesn't want to jeopardize her full-time job. So she's not going public. She's still in the closet. She's still a closet provider. And here I am. I'm going to rat her out on TikTok. It's all good. Sorry, Maribel. But yeah, so if you're on Push Health, my whole point is you can go to N Baldwin, which is Nikki Baldwin. She's on Push Health as well. If you want to transfer to her, all you do is, or go to Maribel, just email help@pushhealth.com and ask to be transferred over. And you can switch to people who will. So what was the BioBoost? Do we know? Did anybody look it up? Did you look it up?
Looks like it's like a B12, like a B vitamin product with inositol and some other things. I mean, and someone else is asking about Lipo C, so perfect timing. Yeah, I mean, some people actually swear by them. They love them. They give them all kinds of energy. Other people get them. They're like, this doesn't do anything. So it's really kind of hit or miss. We're happy to prescribe those, for you to try. It's not typically going to hurt you unless your B12 vials or levels are insane. But yeah, happy to let people try them.
Yep.
But
some people, they swear by them. Some people
do. Yeah.
Give it a shot. Excuse the pun. Our protein shake's okay on days I'm just not hungry. Abso-friggin-lutely. Yep. And if you're like, well, I need some fruits and vegetables because, we got this thing, we do need fruits and vegetables. We need plants. We need protein. We need food. Have a couple of apple slices, or, have a little orange or a little clementine. You know what I mean? Just don't force it. Allow the drug to do its job. Remember, the food you're not eating gets eaten off your rear end. It's a beautiful thing. Unfortunately, mostly off your rear end.
It's okay.
But yeah. Feedback on the Mike BC to help with the weight loss. Yeah. So really, any of the boosters, the Lipo C, Lipo Slim, Lipo Fit, Lipo blah, blah, blah. You don't have to waste your money on it. If you want to buy an Amazon B or C supplement over the counter, the bioavailability is the same orally by mouth as it is injected. So,
but some people still, they try the B12 sublinguals, do nothing, and the injectables are like a whole new ballgame for them. So it's possible how they absorb them. But in the studies, yes, they absorb the same.
Yeah.
Yeah.
Right.
They won't harm you, so we are happy to help prescribe them. And if you love them, great.
Yep. All right. So we are back on Monday at 1 p.m. of MTHFR gene mutation.
Mm,
Hold on.
a little different.
Yeah, that's a real question. I mean, that's
got to dig in a little.
because that's, yeah, that